My name is Lindsay Martin and I'm a Specialty Registrar in Public Health in NHS Fife. I've been working as part of the contact tracing team and I thought you might want to hear a bit more about what we do. We're following you up from the NHS because we've been notified that you recently had a test for coronavirus. It's really important that anyone, as soon as they're symptomatic, goes and gets a test for coronavirus, and the information will be available alongside this video for you. If you receive notification that you've had a positive test result for coronavirus, we'll follow you up and ask you a little bit more about your symptoms, things like, for example, the date that you started to feel unwell, and we'll also ask you a bit more information about the activities that you've been doing recently. By following people up in this systematic way, it allows us to break the chains of transmission of coronavirus in our population. Based on the information you've given us and the guidance that we also have from our national partners, we follow up anyone that's identified as being in close contact with you. It's really important that we do this because we then have an opportunity to provide them with advice about self-isolation and also the support that's available for them. I'd like to let you know that everything you tell us is treated confidentially. It's really important as soon as you've got symptoms that you self-isolate from that point and don't wait for the result of your test before starting that self-isolation. This helps prevent the virus from spreading to other people that you may come in contact with. We know that self-isolation can be really difficult for people for a number of reasons, and we also offer a phone number for you to phone if you need any support during that time. This could include things like someone to drop past any prescription medications that you may have. When you receive a phone call from our contact tracing team, it may come from a phone number that you don't recognise or are unfamiliar with. If at any point throughout the call you would like to verify this in any way, we can provide you with our switchboard number, which you can phone back through so you can ensure that you're speaking to a legitimate person in the contact tracing team. We will never ask you for any of your financial information as part of the call, and we can also provide you with additional information, for example the date that your test was taken, as a way of verifying that we're phoning you from the contact tracing team. We know that so far people have done a really good job of social distancing and self-isolating when required. It's really important that people continue to do this so we can remain having low levels of transmission in our population and having fewer people become unwell from coronavirus.